Hello everybody, welcome to the Animal Eye Guy. Today we're going to talk about cataracts. A cataract is an opacity in the lens, which is the structure in the eye that should focus light onto the back of the eye. And if there is an opacity that obstructs light from getting into the eye, and that can be a cause of blindness. Well, there's all sorts of reasons why cataracts can occur. One of the most common reasons that I see is diabetes, which causes cataract in almost or over 80% within a year after diagnosis. Probably followed by genetic cataracts, and then there's a whole bunch of other types of cataracts, sometimes caused by chronic inflammation, sometimes caused by trauma and other reasons. So we call those secondary cataracts. Well, more often than not, we do see both eyes affected, but they don't always have to be affected to the same degree. Some types of cataract affect one quicker than the other, and then we might see an earlier stage cataract in the other eye with signs of progression. The most common causes of cataracts due to diabetes usually cause bilateral blindness due to cataracts pretty much at the same time. We see cataracts in all types of dog breeds, more rarely in cats, but usually in dogs. We commonly see cataracts in Bichon Frises. We see them with the increase of the population of French Bulldogs. We see quite a lot of those as well. Labrador Retrievers, Cocker Spaniels, Boston Terriers, all sorts of terrier breeds. So there's hardly any breed that cannot develop cataracts, but there's some more predisposed than others. Well, unfortunately, there's not much else you can do if you have advanced cataract rather than do cataract surgery. There are some eye drops that are used in humans which can reverse some types of cataract in humans. This has been studied in animals as well, but the research isn't that convincing that they work. I've personally tried it in a lot of my patients, and I've never been successful at reversing cataracts with any of these products, right? So unfortunately, at this point, cataract surgery is the only treatment option for advanced blinding cataract. Cataract surgery, I always say to all of my clients, it's not a life-saving procedure, it's a quality of life enhancing procedure, and it's also a very involved procedure. So if any of your relatives or anybody else in your family's ever had cataract surgery as a human, although the technique, the surgery, everything else is very, very similar, the experience will probably be very different, as cataracts in humans tend to be a lot more straightforward than they are in animals. I tend to operate for two reasons. One of them is if the cataract is blinding. The second is if the cataract is progressive. And the quicker you operate, the higher I'm expecting to have a successful outcome. So those are the two main reasons. That doesn't mean that every cataract needs to be operated. There's a lot of factors that need to be taken into account here. The animal's age, the owner's ability to provide aftercare, financial capabilities of the owners. Unfortunately, cataract surgery is quite an expensive procedure, as well as the willingness to take risks on behalf of the owners. So if as an owner you're particularly anxious about things going wrong, or potentially spending a lot of money on a procedure that doesn't have a 100% success rate, then cataract surgery might not be the best procedure for your animal. However, if you have an animal which is completely blind and is not experiencing the same quality of life as it would have done, then cataract surgery, unfortunately, is the only treatment option to restore that vision and try and get some quality of life back. So if cataracts have been diagnosed in your animals, and if you decided to go ahead with the procedure, usually your pet will have to have medications pre-operatively, so some eye drops before the operation is scheduled. Most institutions that will offer cataract surgery will admit their patients, do the procedure. Some of them will send them home the same day. My patients tend to hospitalise them for at least 24 hours, as the immediate post-operative phase is the most critical when it comes to things like pressure spikes and other problems. After discharge, I usually see my patients back the first week after the operation, then 2 weeks, then a month, then 3 months, and then every 6 months long term. The reason we tend to see our patients back long term is the fact that an eye that has had cataract surgery done will always be more prone to flare-ups of inflammation. It will be more susceptible to problems like ulcers, pressure problems, etc. And that is a long-term risk. So if you have cataract surgery as a human, you can expect that human being to go back to the ophthalmologist if they have any blurry vision or any signs of discomfort, etc. An animal might not show you that at the early stages, and by the time it actually shows symptoms, it might already be too late to do anything about it, which is why close monitoring, even several years after the operation, and long-term follow-ups, I think, are key to success. There's also medications that will need to be given post-operatively. So usually they have a combination of some anti-inflammatory eye drops, some pressure drops, perhaps even some antibiotic eye drops, some lubricating eye drops, oral medications such as anti-inflammatories, antibiotics. It depends on surgeon preference. It depends on who's doing the actual procedure. So the first 2 weeks after the operation, you can expect to be fairly labour intensive. And then as time goes on, medications will be tapered, some medication will be changed around. It will get easier and easier over time. However, the post-operative phase, the medications is equally as important as the operation. So you could be the best surgeon in the world. If the owners aren't able to provide medical care afterwards, that operation is almost doomed to fail. That's a difficult one to answer because there's a lot of variables involved here. We expect to have an overall success rate of about 80 to 90% within the first year after the operation. Now that number can drop a little over time. So if you look at the same population 2 years after the operation, we tend to see a success rate somewhere between 70 to 80%. That can be due to all various kinds of factors involved. A lot of our patients have other sicknesses as well, such as diabetes, Cushing's, etc. And these other diseases can also have an influence on the long-term outcome of the procedure. But we do expect a successful outcome. Unfortunately, there is a proportion of patients where the surgery goes well, the aftercare is done properly, and we still end up seeing a complication. And those are the devastating cases. And in the worst case scenario, that could result in loss of an eye. So that's the worst possible outcome that you can obviously expect after a procedure. But unfortunately, it's something that needs to be considered as a potential outcome. Overall, in my case population, my diabetic patients tend to do slightly better than cases with long-standing age-related cataracts, just because they go blind very quickly, we see them very quickly, we operate them very quickly, so there's not a lot of time for those cataracts to cause severe harm inside of the eye. If you have age-related cataracts, that can be different. They might be there for several years, and then as time moves on, those cataracts will cause changes within the eye that can make the success rate lower, or cause long-term complications that can result in blindness. Well, a cataract that is not treated with surgery will cause a level of inflammation. That inflammation can cause changes within the eye that can either make the pressure in the eye to go up, we call that glaucoma, and that can cause blindness and pain, or what we call a retinal detachment, where the light sensitive structure in the back of the eye detaches, and that detachment can then cause glaucoma due to release of toxins and inflammation, which then in turn can result in loss of the eye due to the glaucoma caused. The risk of having one of these long-term complications, if you compare populations of animals who've not undergone cataract surgery versus the ones that do, is about 250 times higher in patients who've not undergone cataract surgery. Unfortunately, there are some cases with cataracts which aren't suitable for cataract surgery. So patients who've got end-stage disease in the back of the eye or high pressure to begin with, or who don't have signs of vision, aren't regarded suitable candidates for cataract surgery. And in those cases, we'll have to shift our focus from trying to restore vision to trying to keep them comfortable. And in those cases, we tend to monitor them long term. And then if at some point the eye starts to become uncomfortable for them, we might need to decide to remove that eye. A lot can go wrong after cataract surgery. Unfortunately, the two main complications of cataract surgery are glaucoma, which is high pressure in the eye, followed by retinal detachment. Both of these complications have a roughly 5 to 10% complication rate in the overall population. There are some breeds which are more predisposed to one or the other. Other complications that can happen are things like ulcers, so that's something that we always check on every recheck. Dry eye disease, so patients, particularly small breeds, particularly the ones who have diabetes, are more at risk of developing dry eye disease. That is something that can then in turn cause ulcers and discomfort and other problems. That's something that we always need to monitor for. And there's a whole host of other conditions that can happen after cataract surgery, which is why the follow-up appointments and the post-operative treatment is so important. So I hope you find this information useful. If your patient, if your animal has a cataract, or if you're worried about a cataract, it's probably best to go to your GP vet to have that examined. If they're not sure, or if they would recommend referral to get a second opinion, then it would be helpful to contact a veterinary ophthalmologist to have that looked at, and then they can discuss what we briefly discussed here in more detail. Thank you very much for listening.